I'm Dr. Hitesh Kubadia. I'm an orthopedic and a joint replacement surgeon practicing in the city of Mumbai, and I have my clinic located in Dadar by the name of HKS Clinic. I'm here to address a few queries about the shoulder joint. A lot of patients who do come to me with shoulder joint pain, they tell me they have a frozen shoulder in the joint. They've been diagnosed to have a frozen shoulder. Uh, they may have a frozen shoulder, but very often I have seen they are actually not frozen shoulders. What they have is called something called subacromial bursitis. What happens here is because of some strain or because of some pull, they have some swelling in between these two bones. Okay, this swelling. So what happens in this swelling is when you have this swelling in between these two bones, the movement of the shoulder which happens gets restricted because the swelling comes in the way, and this causes impingement there. This causes a lot of pain. This reduces the movement of the shoulder joint, and hence very often people diagnose it as a frozen shoulder. Uh, this can be easily be attempted to diagnose on a clinical examination. Very rarely we need to do an MRI scan to understand this. What we normally do for this is a simple cortisone injection in the shoulder joint, which helps to reduce the swelling and decreases the pain. And this, once the pain is reduced, the shoulder starts moving very comfortably. Okay, and then the patient with good physiotherapy can get on with his routine life. This is one very common problem, so I thought it's important to address this. Another common problem which a lot of patients come with is the shoulder dislocating very often. The shoulder joint is a ball and a socket joint. It has a ball in the form of the humeral head and a socket. Okay, shoulder being a very versatile joint and has a lot of movements, the socket is very shallow. To increase the depth of the shallow, there is a special tissue called the labral tissue around it. Okay, this labral tissue increases the depth of the socket so that the shoulder moves within the socket. But what happens if there is for the shoulder to come out basically? It has to tear something and come out. It will just not come out like that. So very often what is torn is the labral tissue. So what happens when the shoulder comes out, this labral tissue moves back. And when we put the shoulder joint back in its place, the labral tissue doesn't come back to its place, it remains there. So whenever patient, this makes the shoulder, makes it very easy for the shoulder to re-dislocate again and again. Okay, every time the shoulder dislocates, there's more damage which is causing to the ligaments and the joint itself. So what is recommended is we repair this labral tissue back to its position. Okay, so that the shoulder joint moves within its limits and it doesn't come out. So this is done arthroscopically. We repair this labral tissue. It cannot be seen in this because it is very deep inside. The labral tissue is repaired back to its socket, and this prevents the shoulder to come out, and this helps out for the recurrent shoulder dislocations. Another common problem, especially in the elderly age group, what we see is a rotator cuff tear. Now, what is a rotator cuff? It's a very common pathology. Rotator cuff is a group of four muscles. In the front is the subscapularis. In behind there are three muscles: the supraspinatus, the infraspinatus, and the teres minor. These are medical terms. You can uh, get rid of it. Just call them the rotator cuff. Very common tendon which is torn is the supraspinatus. So what happens is when this tendon tears, it actually retracts. It goes back. Okay, it goes back and it comes and lies in between the two bones here. So whenever there is a movement of the shoulder, it comes in the way. Again, it causes impingement and causes pain. And it being a very important stabilizer of the shoulder, the movement of taking the shoulder out becomes difficult. So even simple activities of doing household jobs like turning, churning, it causes a lot of pain. So what is done if this tear causes a lot of debility in the routine activities? We try and get this back to its original footprint, the muscle back to its footprint, and fix it down there with special suture anchors and fiber tapes. And this stabilizes the shoulder for the long run. These are the common pathologies around the shoulder joint which are routinely seen, and they have very good. We have a very good armamentarium. We have a very good systems in place today with the modern technology to help these patients out and get on with their lives and decrease their pain in day to day life. Thank you.